The Response, Recovery, Resilience for Conflict-Affected Communities in Ethiopia project is a government-owned initiative to provide basic services and support for gender-based violence survivors, funded by the World Bank and implemented by the Ministry of Women and Social Affairs, with UNOPS as a partner of choice and UNFPA facilitating gender-based violence support activities in Tigray.
As the Ministry of Women and Social Affairs, we didn't just fund and oversee this project. We actively shaped its direction. We ensured alignment with national policies, strengthened coordination between the government and other agencies and partners, and helped create an enabling environment for service providers.
The TRIA project in Tigray was an important initiative that government brought up, and as part of that initiative, UNFPA was co-opted, to also support, and UNFPA implemented all things related to gender-based violence.
It was in the middle of the war when we started. And the war not only had infrastructure implications, but had human impact as well. One of them was the gender-based violence. A lot of rape cases that were happening. Women and children were primarily the victims of such situations normally. And the fact that the services were not available to start with, the ones that were available prior to that were damaged, created a huge gap in terms of the GBV-related services.
UNFPA was able to provide support to women and girls in the area of gender-based violence. At the same time, we were able to build the resilience of women, especially on the economic side. And also, we were able to restoring the dignity through the dignity kits that we provided.
We've also managed to rehabilitate schools, health facilities, water and sanitation facilities. We've provided supplies to make sure these resources are being able to use effectively. And more critically important, we provided gender-based violence services and provided training for personnel on gender-based violence as well as mental health.
So our role is to coordinate the project with different implementing partners, stakeholders. The overall project management responsibility was the responsibility of UNOPS that have been identified as a third party for this particular project. So that was the role of UNOPS.
We also had key partners at the regional level, at the level of Tigray, like the Bureau of Finance, Bureau of Women Affairs, the Bureau of Health, and the Bureau of Youth. We also have the communities, the community structures that we use, like the women-led organizations, the religious leaders, the various groups at community level that also help us to really implement this project.
So we provided financing, but I don't think that's the most important thing that we did. I think the critical part was that we were partners on the ground. We were every step of the way working with the authorities, working with the communities to make sure that we were able to implement this program on the ground.
Over 1.8 million vulnerable women and girls received critical GBV services like medical care, psychosocial support, livelihood, and legal aid. We ensured that 97% of GBV survivors had access to comprehensive multi-sectoral response services, and this is really a remarkable achievement given in the challenges in the region.
The fact that most of the structures like the health facilities and others were destroyed also affected implementation. All other things in terms of empowerment of the survivors, especially economic empowerment of the survivors, was critical for us to be able to address the needs.
A third component is the fact that we're very much focused on building back better principles, which meant like we were not only renovating whatever was damaged, but we were also doing additional factors such as, for example, ensuring we have sustainable energy access, we have sustainable water access or wash services, and also trying to really make sure that all the rehabilitation work is being done with the highest standard as much as possible. So I think that was another very important one, because that was the sustainability factor was very important from building back better principle perspective.
When we talk about sustainability of GBV services, we are not only just talking about continuing giving the services, it is just a matter of building system. In order to do so, there were capacity building trainings which have been just given to the local communities and to the local structures or administration as well.
Working with the religious leaders, working with the women-led organizations at community level also help us really to build sustainability for us to be able to continue even if UNFPA is no longer there one day.